The first day of class in January 2020, I sent this email to my students in my microbiology class. The assignment was simple for Wednesday. Read this news article about a mysterious pneumonia in Wuhan, China, as well as the associated World Health Bulletin, and come to class prepared to discuss it. And discuss it we did. So this article had a lot of really good information, and whenever I teach about diseases, I always teach from a comparative standpoint. What kind of disease does this look like, and how does that inform us in a variety of settings? And so, for example, right off the bat, one of the very important things, and very odd, was that it doesn't appear to be spreading from person to person. So if it's not spreading from person to person, how did you get it in the first place? Well, the evidence was that it probably jumped the species barrier. So what that means is that people were getting it from animals. And even people that got it from animals, apparently they weren't then giving it to other people. And so that right there, with this mysterious pneumonia, the CDC then put a travel one advisory where if you're going to Wuhan, stay away from animals, whether they're alive, whether they're dead, just stay away from them, and stay away from infected individuals, just in case. Right? So this article then compared this particular mysterious pneumonia to SARS, and that's because it's a notorious example of a virus jumping the species barrier at a wet market from an animal. In other words, animals in cages, people interacting, getting to that. So why did they start thinking that it may be this type of scenario? Well, the first case of this mysterious pneumonia was from a person that worked at one of these wet markets that handles a lot of animals that come from the wild. And so at that point, there were 59 cases of this. This is what we then come to know as COVID-19. So at the beginning of this semester, we started with 59 cases. And every day, we followed this disease through all of the turns, through the numbers just going up, from it spreading in China to spreading and becoming a global pandemic. And so the World Health Organization bulletin, came out early January and alerted the world. And when they do this, all countries should be on high alert for something like this. And again, the thing I just want to emphasize is that no evidence of significant human-to-human transmission. So that just goes to show you how early in an outbreak, there's still so many unknowns, we can get it wrong, right? We don't have the evidence to show us, because we know that this is transmitted human-to-human very well, and we know that there's a fair amount of asymptomatic transmission. And so this city of Wuhan is a very large city, 11 million people. And so what they started doing immediately in China is they started doing what we do with respiratory diseases. You isolate the sick, you quarantine the exposed, you talk to them and trace all of their contacts to then say you were exposed, quarantine yourself. They shut down that seafood market, they destroyed the animals and disinfected it, and they started doing temperature screenings in Hong Kong. Like at all the airports in various places, they started doing temperature screenings. Now, if we look at this, so Wuhan is pretty far from Hong Kong, and so why were they so worried about it? Well, as I'll show you in just a moment, we know that Hong Kong is a central place where a lot of people from Wuhan go. Wuhan is a crossroads, and a lot of people during the SARS epidemic in 2003, 2004, a lot of people with SARS transferred around the world from Hong Kong. So they knew that if there was some new respiratory virus that jumped the species barrier in Wuhan, it was going to be very quick for it to get to Hong Kong. And if it gets to Hong Kong, it can get out of Hong Kong, go worldwide very quickly. And so, what we then did is we monitored all the news organizations, we followed the numbers, and then we also looked at some chemistry. We looked at different microbiology, we looked at virus structure, we compared it, we looked at how disinfectants work, and that's what we do in my classes. So in this lower level microbiology class that I was teaching, it was for mainly nursing students, so we didn't get into higher level chemistry. So I'm a professor of biology and chemistry. My PhD is in biochemistry, molecular biology, and biophysics, and I really focused on biochemistry, and I'm also a microbiologist. So I work with infectious bacteria from oysters, for example. And so I marry those two disciplines and bring that to the table in whatever classes I teach. And so back to kind of us looking at this. So if we fast forward from the first week of class, we fast forward a few weeks, one of the big concerns was, okay, we see the case count increasing in Wuhan. This is a bad time to have respiratory disease, a very bad time. Not that there's a good time, but basically this was happening during the lunar holiday in China, which is where a lot of people travel, and we're talking, many millions of people, billions of trips to be with family, to celebrate, right? To be together. That's what you don't want during a respiratory outbreak. It's getting together. And so now in Asia, it's very accepted to wear face coverings and face masks and medical masks in public. People don't look twice. So from a cultural perspective, they're kind of ready for a respiratory disease in terms of wearing that. And then not long after that, they put Wuhan on lockdown. 11 million people, unprecedented. And then soon after that, things were just getting out of hand. 35 million people in China were put on essentially lockdown. And if you look at some of the images when that was happening, ghost streets where normally it would be packed with people, because they knew you got to keep people away from each other or it's going to spread like wildfire. So not long after that, the mayor announced that although Wuhan was on lockdown, about 5 million people were estimated to have left Wuhan before the quarantine. So we expect that there were a lot of infected people that then traveled and passed it on very, very readily. So a few days after that, the World Health Organization declared a global health emergency. And on the same day, the United States put in a travel ban from people that had been in China. So if you were not a US citizen and you'd been in China in the previous 14 days, you were not allowed in. I thought that was a very smart call immediately when it was announced, because there's just way too high of a chance to spread this. And at that point, we were still thinking that we could contain this thing, right? If we could contain the virus from becoming a full blown out pandemic, let's do whatever we need to that. And so as we talked about in class, at that point, there were multiple ways it could go. It could be contained and it could go on the downslope like SARS. Or it could become a global pandemic, cause a lot of havoc, a lot of death, a lot of heartache, and become something like the 1918 flu. Or it could evolve into, to be more specific, something that's more of a mild respiratory disease that we have year in and year out, kind of like influenza, right? So it looks like, in retrospect, it's going to become the first one, global pandemic, lots of heartbreak, lots of deaths, lots of pain and suffering, right? And then, the big question is it going to be a virus that just lives with us? I have a hunch that it will be, that we're just going to have this in our life. And so, if we go back to the beginning of the semester again, not long after that, I think it was the second week of classes, the genome was sequenced. And so then it was definitively shown this is very similar to SARS. So let's start using SARS to inform how we look at this disease. And so that's what we do in my class, right? And if you look at these magazine covers from the original SARS outbreak in 2003, 2004, they look like they could be magazine covers for COVID-19, don't they? People in masks, right? What did Beijing know? Could this become China's Chernobyl, right? So there was a lot of important issues that came out of that first SARS outbreak, and we learned a lot. So let's discuss about what we learned. Well, one, this is the case count per day. It's not a complete case count. These are the confirmed cases. There's another 2,000 or so probable cases. But what we saw is we saw kind of a slow burn at the beginning, right? Sporadic cases, and then what we saw is this big peak. And then it went down, and then what we have is this big larger peak. So we had 2 waves of it, right? And then we got it under control, which we'll talk about. I like this particular image because what it's showing us is the individual cases in Hong Kong. Of the 1,755 patients, where did they get it from, right? And this is one of the key things you do in epidemiology. Where did you get it from? Who did you give it to? How is it transmitted? How are you feeling, right? And so if we just look at these particular cases, the colors should kind of scream out at you. What are the 2 most prominent colors on this? That's right, we've got red and we've got purple. Okay, so the red, we'll talk about in just a moment. The purple essentially is from, the red is from the hospitals, that's right, all the way through, and that's what reminded me that that's what that is, because I can't see the colors too well. All the way through this entire thing, the red. What we're talking about there is we're talking about hospitals. We're talking about elderly care. We're talking about long-term care facilities. We're talking about doctors. We're talking about nurses. And if you look at the prevalence of those red cases, it looks a lot like COVID, doesn't it? Our healthcare workers, our nursing homes getting hit hard. And the other striking color is this purple here from Amoy Gardens residential buildings. When this was happening, and I was reading the articles on this back in 2003, 2004, it was being referred to as an apartment complex. And so my vision of an apartment complex is very different than what this apartment complex is. So look at this massive number of very tall buildings, over 15,000 people living in this apartment complex. And 3 of these towers, there was massive infections in. And there's a number of ways that it was infected. 2 are the most come most to my mind. One is when you go in that tall building, there's elevators, there's stairs. You go in there, you cram together, you've got respiratory disease, you're spreading it to each other, right? So any type of group setting. And the other one, and this has become quite notorious, is due to aerosolizing human sewage from people that had SARS, and they had SARS in their diarrhea. So if you look at this, right, what we've got is essentially these drains, right? So drains have that U in it to trap water. And the purpose of that, it's not to catch your ring in it. The purpose is to prevent sewer gas from backing up and coming out into your bathroom or into your kitchen, wherever it may be, into your gym. And so by having that water there, because all the pipes go to the sewer, right? So the sink in your kitchen, that pipe somewhere meets up, right, to the sewer pipe. And so you always want water in those, because in this instance, what they found is that some of the restrooms, some of the bathrooms had floor drains. So when you clean, like at a gym, you clean the floor and you put all the water in there. Well, it's a place to put the water, and it fills up that trap, that U-trap, so that you don't get sewer gases coming out. The floors were not being cleaned with a lot of water, and so those drains were empty. And so what happened was, when there were powerful exhaust fans pulling air from these bathrooms, and there was no water in the U-tube, essentially what it was doing is it was pulling sewer gas up into the room, aerosolizing people's feces, and putting SARS into the air. Horrifying, right? And it's not something that you would come in and you would see. It's not even something you necessarily smell. Maybe you would, I'm not sure. But it's aerosolized, so it's there in the air and you don't even see it, but you're breathing it in high quantities. And so those are 2 of the lessons we learned from SARS. So early on, I was always worried about people getting diarrhea, and the fecal-oral route is what we call it in microbiology. Unfortunately, at the time of this taping, there's not been much incidence of that at all. Thank goodness. And so, in terms of Hong Kong, I mentioned that for COVID-19, when it was just this mysterious disease, they started temperature screening in Hong Kong. And so when we look at the reason why, for the original SARS outbreak, everywhere, so Hong Kong is here in the center, in that circle right there, and then all these black lines show documented cases of this disease leaving Hong Kong and traveling worldwide, and that's what they wanted to prevent. So the other thing we learned is that SARS was a zoonotic disease, and all the evidence points to this story. Humans got it from a palm civet cat. So when I look at this animal, it's just so cute. I want to kiss its little face, hug it, but it would probably rip my face off because it's a wild animal, right? And so, however, it's believed that the evidence points to people getting infected from these palm civet cats. However, in the wild, palm civets aren't known to really harbor much in the way of coronaviruses. However, these horseshoe bats do. And so these horseshoe bats, stably, studies have shown that some horseshoe bats populations can have hundreds of different coronaviruses, right? That's where they live naturally. They may not be doing anything to those particular bats, although some might, right? It's just like right now, we have a lot of bacteria on and in us that are beneficial, right? We have our microbiota, the human microbiome. We've got viruses on us, and most of those are good, right? They're beneficial. So same thing with wild animals. And so then the question is, okay, well, if the palm civet, right, doesn't normally have it, okay, well, in the wild, it could have gotten it from the bats, but how did the people get it from the palm civet? Well, that outbreak originated in one of these wet markets. And so what we're seeing in these images are markets that sells fruits, vegetables, animals, various seafood. Some animals are already slaughtered. Some are live that you can buy live and bring home, or you can pick an animal and they'll slaughter them right there for you. And so the problem is when you have all these animals in cages close together, whatever microbes they have are there, and even if like one's sick or one's not sick, they can transmit it. And so this is a recipe for disaster, especially since there's a fair number of places where there's animals where people go out into the wild, they trap wild animals, they bring them in, exotic animals, and sell them. So whatever disease agents that might be able to affect us are now brought into a human population where normally people wouldn't be interacting with the horseshoe bat, right, with a palm civet. And so by disrupting these ecosystems, by going in and getting these animals, we put ourselves at great risk. And so this is the evidence that we have for that's where SARS came from. It was originally in a horseshoe bat. It somehow got to a civet, and then humans got it to civet. And then people started giving it human to human. And so we also learned of some really interesting super spreader events, really horrible things where basically super spreaders are a small number of people who give the disease to a very large number of people. So maybe on average, one person infects 2 people, but there are super spreaders where one person may give it to 15, 20. And so when we look at this, this is just one cluster, right, from Singapore showing, now if we look over here, patient number 1, so this person number 1, right, every person is a circle, every arrow shows how you got the disease. So for example, this person gave it to this person up here, and it doesn't look like that person gave it to anybody else. But if you look down the line and you see that one circle, an arrow, and then a circle to another arrow, what you see is that one person you can kind of think of as really, it all came from that person originally. And so imagine if that first person, when they immediately came sick and they knew it, if they isolated themselves, maybe they wore a mask. Imagine if that person could have prevented giving it to however many people they gave. And so if they prevented it giving to those people, all of those people prevented it from giving to the others, then they didn't give it to these. And so when you backtrack, that's the power of epidemiology. By contact tracing, you see what is going on, you understand the disease better, right? And so these super spreader events aren't just SARS and aren't just respiratory diseases. They're something that in the field of microbiology and epidemiology are something that we deal with on a regular basis for a variety of diseases.